Anyone anywhere in the US can dial 211 and receive access to resources for their area. In New Mexico, we have 8 211 call centers. However, Chaves County is the only call center that is operated by a health council and fully independent of the United Way. We took over the 211 program in 2019 from the Chaves County United Way. Our board could see that the program had potential and felt it was being underutilized and needed a dedicated staff member. So currently we have one full-time certified community health worker who answers the phone from 8:30 to 4:30 during the weekdays. Next slide. All right, so what does that mean? In order for 211 to be effective, we have to coordinate with the community. We need to assess the we need to do a community assessment and find out what resources are needed in the community, and then find out what resources are available. Through the health council, I'm able to map out our assets because we have the majority of the community members that would provide resources on our council. And that's our coordination. Next slide. And then 211 utilizes a closed loop referral system. When a caller calls, states that they're looking for, let's say, basic needs assistance like housing, the community navigator is looking up the rental assistance to find out which programs are available. The closed loop network will let the navigator reach out to those programs and see if they still have funding or don't, and then move on to the next resource that's out there. Many times the callers are telling us why they couldn't make their rent. And let's say it's because they were in the hospital or their new prescription drug costed too much. Because we get all kinds of information when they call in. When they do that, then we are able to look up the additional resources that they need so that maybe we can prevent next month being a crisis for them. Sometimes we're only providing the one resource, but most of the time we're looking for the additional resources. And we can do a warm handoff. So if we have a group that only works with certain people, but they have to be recommended, we can go through their process of their application process and determine if they qualify for that program, and then call that program and then hand it off to help fulfill those unmet needs. Next slide. And then to make the whole program work, we have to have a group who is committed to the community. We spend a lot of time locating resources and reaching out to the providers and building those relationships. They have to know that we know what they're doing and that we can relay the information correctly to our citizens. So we need to have a basic understanding of each of the programs in order to link the callers to the right resources. We're constantly updating the resources and information as well. And that's our normal day-to-day operations of our 211 program. And then sometimes, in a blink of an eye, things will change on us. Next slide. So, my name is Carrie Moore, and I'm the director for the Chaves County Health Council. In my previous life, I owned and operated a food truck and restaurant for the last 12 years. I've been fortunate enough to be featured on the cooking channel for 3 different shows. Prior to that, I was the food service specialist for the Roswell schools for 12 years. And that's the equivalent of being the assistant food service director for our area. I managed the day-to-day operations of the cafeteria program, made their recipes, did all their nutritions. But my main background is in marketing and graphic design, which is how I became familiar with the Health Council. Back in 2019, I was asked to design and help do the marketing for the first Health Expo. And ever since then, I have volunteered with them. Next slide. So On June 17th, well, so in June, they asked me if I would come on and actually be employed with the Health Council. So my first day in the office was June 17th. I don't know if you guys know of anything else significant that happened on June 17th, but if you were in southern New Mexico, you know that was the night Ruidoso was evacuated due to the wildfires. I got home after my first day in the office and I found out there was a fire. I'm all over social media. I'm watching things unfold. And then about 8, 9 o'clock that night, we get the notification that Ruidoso is being evacuated and that the majority of the mountain is headed down to Roswell. Our biggest source of information is Facebook. That's where everybody here finds out what's going on. And then once they found out that people were coming here, Facebook was being flooded with the locals saying, I have room for your livestock. You can park your RV camper here. I have an extra bedroom. This information, I mean, was just flying out left and right all over Facebook. But one of the problems is, you know, when you need something on Facebook, you can never find it, right? You know it was there, but you'll never see it again. It always disappears. So at that time, I decided, well, okay, this is a lot of information. So I started copying and pasting it and creating a post where people could get it just from one place. You know me, you can find it. Turned out there was way too much information for that. So at that point, I decided, well, we're gonna have to create a Google Doc. This way the document was static. I could post that link and then we could update it as fast as possible. And then if anybody had access to that link or to my Facebook or wherever, they could constantly see it. And then the information was just being updated nonstop. I spent all night doing that. I don't know how much sleep I got. I think it was probably like 2 hours. About 1 o'clock that morning, I had a friend ask me, do I want to put together a flyer? Because they were going to hand out burritos that morning to everybody who was in the parking lot at Walmart or in the mall or wherever they were. And I'm like, perfect. So by 8 o'clock, I had hundreds of those flyers printed out and handed over to those that were doing burrito runs that morning. So you want to talk about fast and furious? That was fast and furious. And then it was about 8:30 when I got to my office. And I got a call from, it was the New Mexico Department of Homeland Security and Emergency Management. But I'll tell you this, they never say that that's what their name is. They're just the NMHEM, I don't know, some acronym that you can never remember. But what I can tell you is don't call them New Mexico FEMA. They don't like that. But anyways, they called and they said, we saw your Google Doc. Can we use this to help start providing resources as people are calling them and they're trying to coordinate the services? Because they're coordinating through Lincoln County into Chaves County, and everybody here doesn't know all of the stuff going on. And I'm like, yes, use it. I ended up giving them access to the document and they were updating it just as fast as I was. So if they were calling 211, they would get us and we would provide the information. But if they called New Mexico Homeland Security, they were getting the same information from there. It's just so much easier to tell people to call 211 instead of a 10-digit number because nobody can remember those 10-digit numbers. So that was the beginning of our beautiful collaboration. Next slide. Then 4 short months later, we experienced our second disaster. Roswell received a year's worth of rain in one night. We got somewhere between 6 to 10 inches, depending on where you were measuring at. This disaster hit different. Most people had already gone to bed that night. We got the flood warning alerts on our phones, but we don't flood the way we flooded this year. We know to stay out of our low-lying areas, stay out of the creeks. So most people just turn them off and, you know, keep on going about their day. However, again, everybody was in Facebook and started seeing how much water was truly out there and that they were looking at 4 feet of water hitting the buildings and people were trapped inside of them. So 211 doesn't do the emergency response. What we need to do is stay out of the way. So we let the National Guard and the fire and the rescue teams do what they do, and they were getting people to safety. And then the next morning after the water receded, we could start seeing who was affected and how they were affected and the damages that were happening, and people were starting to call in looking for people to help tow their trucks out or vehicles out of the rivers or in the middle of the streets where they're piled up on trees, because that's where they ended up. So we were able to start creating resources of people who were out on the streets who were willing to help doing that stuff. But we discovered that this was a different kind of need than what we were having to go through with the fire. Because nobody was evacuated. There was no stay in place, there was no evacuations. So everybody was still kind of in their homes and almost acting like things were normal, but they weren't. So that next day, I called out for a resource meeting by 4 o'clock that afternoon. I had a meeting set up that had over 75 people there who were providing resources, who could get access to food and water and shelter and the different resources that we needed to keep going. And that was our focus for first several weeks. Again, we were utilizing a Google Docs. We had created forms so homes that were affected, they could sign up if they needed volunteer services to come over there. If people wanted to volunteer, we could sign them up and they can be volunteers, and then we could coordinate and connect the volunteers, the individual volunteers with the large volunteer groups that were coming in. And then get them to the houses that were flooded because it was isolated. We had about 300 homes inside Roswell, and then there was probably about another 100 or so that were in the county at different areas. So nothing was consistent. And honestly, within like 3 days, if you drove through Roswell just on a normal, everything looked fine. It wasn't until you got down into those areas that flooded. One of the things that was different is that our emergency manager had asked us if we would be the contact for missing people. Fortunately, with this episode, we didn't have any missing people, but that did help alleviate some of the 911 calls. Next page. One of the things I did learn on making the Google Docs is that the shelters and different people were printing it out, which meant that once they printed, they no longer had updated resources because we were still updating nonstop. So then I created a QR code and put it at the top of that document. That way, if they printed it, they could scan that QR code and make sure that they had a new updated form. And then, so for Chaves County, our normal annual call volume for 211 is less than 1,200. But so far, just for the first half of this year, our call volume is just under 4,000. And that doesn't include the increased social media and website traffic of over 1,200% that we increased. I'm on the New Mexico 211 board, and prior to the flood and the fires, disasters were not part of the normal 211 operations, but it is now changed. Policies and procedures are being established on how to deal with each type of emergency that an area may face. And I can tell you that my initial list of local disasters started with the 4 basic ones: fire, flood, tornado, snow. Those are the things that we normally encounter here in Roswell. But after our first meeting, I grew up to 12 different emergencies: mass shootings, chemical spills, earthquakes, train derailments, extreme heat, high winds, dust storms, sinkholes. Every area is going to be different, but a lot of areas are going to have the same things. And then how is this going to work for you guys as a health council? You probably won't operate your 211 lines because those will stay with United Way. However, you can coordinate with the United Way and the 211 program. Because as the health councils, you have access to the medical staff and your partners who would be the key people when it comes to doing a lot of these emergencies. So this is where you're gonna have to work with your 211 community navigators, work with your local disaster teams, make sure that they know that you exist and that you're there for them, so that way you can help build that role and establish it. And that is what I have on Chaves County 211. Who has questions?
Oh my gosh, Carrie, thank you so much for that information. I have a question if people are still thinking about it. So you mentioned the 211 is through United Way. So is that how the navigator or the person who answers the call is funded through United Way?
So yes, I don't know, because everybody's a little bit different in how their United Ways do it. Some of them actually receive their funding directly through United Way. Some of them have to do fundraising to cover it. The larger ones, the larger call centers, like the Albuquerque area, they seem to be funded through United Way. Our program, we're not funded from anybody at all. So we have to do it between those of us who are working through the money through the DOH or whatever grants. So we operate off of a cell phone, so we don't have a true call center.
Perfect. Thank you for the context. No, that's very helpful. And it's also showing in the many ways that how DOH funding is being leveraged. I mean, especially for such a critical service like 211 in Chaves County. A question in chat. Have you written a summary report of lessons learned from the two events?
Sort of. I did a report for DOH so that way that they could see what all we ended up going through on that one. I'm sure before all is said and done that I will probably have several more reports that I will have to create for it. Because it was such a huge piece of our fall. I mean, it was a lot to have to do, and we are the first 211 that has had to do any of this. The only other major disaster we had was the Mora fires, and 211 wasn't active in that one. So it's almost like I've rewritten the emergency disaster guides for 211 in a way. Or at least I've got them to start thinking about how we could be extremely beneficial when it comes to this.
Thank you, Gina. I hope that answers your question. And she said, those are so different, a flood, fire, different ways of response. Thank you for the work. As well as Brenda saying that was amazing. So you're getting some good kudos in the chat here.
Thank you.
Hearts. Thank you, Enrique. Any other questions? Feel free to unmute or raise hand. Okay. So I think that's it, Carrie. And if health councils have questions, we're going to share slides and also contact information if you'd like to connect with Chaves County Health Council after this to learn a little bit more about 211. So thank you, Carrie, for your presentation. You did wonderful as our first presenter today.
No, thank you.
Yeah, thank you so much. Okay, it's almost like speed dating today. We're gonna do like speed presenting. So we're gonna hand off to Amanda Evans with the San Juan County Health Council. So I'll share screen again if that's okay, Amanda. All right, and just let me know when to advance.
Thank you. And I apologize, my voice is a little, we've had crud up here with all the bugs and stuff going around. So I may be using my water. Today I'm going to talk about the San Juan County Needs Assessment, and this is done in conjunction with other partners that I'll talk about in a minute, but this is really our planning document that the Health Council uses, as well as a lot of organizations throughout the community. So you can go ahead and go to the next slide. So I am the coordinator. I said I'm Amanda Evans. I've been working with the Health Council since 2008, so I think that's about 17 years now. And started as a full-time coordinator back when we had full funding through DOH, and then have taken some other positions with the partnership. San Juan County Partnership is our fiscal agent, but they are really more than just a fiscal sponsor. They've really hosted the Health Council for all the years when we had low to no funding and kept it going. So our structure with the Health Council is we have myself, who's a part-time coordinator. We have a core team that's made up of 7 members from different organizations that meet quarterly and kind of help guide where we want to go with the Health Council. And then we have our fiscal sponsor, and then we have monthly meetings that our meeting was yesterday, and we have anywhere from like 20 to 40 people. Spring break here, so yesterday was kind of lower attendance than some months, but we've had several other community groups join over the years. The City of Farmington had a homelessness task force, and the person who had been running that was retiring last year. So they actually joined with us. So we've got all of their membership coming, and we've kind of added that as a topic we talk about every month. And so we've added these different groups. We work with Local Collaborative 11. They're part of our group. So we've really kind of expanded and have different partners that come to each meeting. Next slide. So a history of our needs assessment. So San Juan County Partnership has been doing a needs assessment every 4 years since 1996, with the exception of 2020, which I don't think that needs any more explanation than it was 2020. We did do like a really small with just organizations needs assessment that year, but we did not, it was more internal use than published like we normally do. And so the Health Council role has been a part of that kind of process. Some years when we had funding, we would assist with that. Some years we didn't have funding, we would be just part of the survey collection and things like that, survey development, kind of just taking different roles as needed over the years. So we also have in our community a couple other regular needs assessments. San Juan Regional Medical Center, our local hospital, does a needs assessment. That one is really focused on medical versus the one we do through the partnership, and our partners are more social service, broader topic than just medical. So when we go for medical data, we usually, or when we're looking for medical data, we'll use that as one of our resources. And then San Juan County several years ago did a behavioral health assessment, and hired contractors that came in and did like a whole assessment over our behavioral health system in the community. And so those are both two that we resource and kind of utilize from their information. Next slide. So this is our needs assessment link. I just put it in the chat too, so if people want to look at it, it is on the partnership website. It's like 157 pages, I think. I can't remember if it's 154 or 57, somewhere in there. So it's a large document. And then on the website, it also has the one from 2016, I think. Next slide. So in our 2024 needs assessment was commissioned by multiple agencies. Our needs assessment is really a large effort by multiple partners to get this off the ground. It's funded by San Juan County, City of Farmington, San Juan United Way, and then the Health Council as well. It's compiled and written by Noah Salvatore and Shannon D. We contracted out because none of us are data experts in the way that they are. And I think that's really important to have someone who knows how to find the data and how to utilize it and how to analyze it. And so we contract with them to do, they've done several over the years. We've had different contractors throughout the time. Next slide. So how we started with this, it was our 2004, our 2024 report, but we actually started mid 2023 with planning, gathering funding. We ended up starting survey collection in November and December of 2023. We collected 1,626 surveys, 1,414 were online and 212 were in person, with a focus on rural areas where we wouldn't see as many people with internet access, because we really try hard to get a diverse people filling out the survey. We want to get people from different areas of the county. We try to make it as representative as we can as far as demographics, as far as race, male, female, areas, all of this. It doesn't always get perfect, but that's the other part of hiring contractors that really know their data, is they're able to weight those and things as they're putting the data together. But we worked really hard to, this was the most surveys we've ever collected on one of these. So we marketed it through utility bill inserts, through paid social media, posters, flyers. For online, we did drawings for $2,000 gift cards. We also did paper surveys, each paper survey received a $20 gift card. So this whole process cost us about $30,000. And that's why we have so many partners that work together to do it, because there's just a lot of pieces that go into it. I said we started about mid 2023. We got the final product September of 2024. So it's basically a year-long process between when we start survey collection to when the final document comes out. Next slide. So in addition to community surveys, and that is just the general community population, we have key informant surveys that we did. So these were specific to people who worked within organizations and might have more information specific to the topics we were talking about. So we had 79 who started the survey. We had 49 completed. And these were some of our areas. So we had healthcare providers. We had a lot of behavioral health and substance use counselors. We had business owners, church and faith-based, education, public office, government, law enforcement, housing, social services, and media and music radio. So we really tried to get a diverse group for the key informant surveys as well. Next slide. So focus groups. So after we had done both the community surveys and the key informant surveys, we took the top issues that came from both, which they did not match up exactly, because you're going to get different responses based on the different people in the groups. So we took top issues from both of those two surveys, and they came out as transportation, access to healthcare, crime/public safety, education, business/economics, and housing. And so we took each of those topics and did a focus group on that topic with a range of people. We had 8 to 10 in most cases, some a little less, some a little more. And we tried to get a couple people who would be people who work in that sector. We tried to get some community members. So for like transportation, we had someone who rides the Red Apple Transit, which we have here. We had a bus driver for it. We had some city officials who put together like the funding for it. We tried to get a wide range, so we weren't just looking at key informant or community for these issues. And then we used an evidence-based format called nominal group technique, so each focus group was very structured. We asked the same type of questions. We followed the same format. We had to keep people on topic, which is really easy because all of these kind of overlap and stuff. But so really to keep it easy for our contractors to do their job and take the information and put it into this format, we try to keep it as cohesive and consistent as possible. Next slide. So they also used other data. So not just what we collected, but they took data from 100% San Juan County that they did their survey. So they used some of their survey data. The US Census, New Mexico Department of Health, Centers for Disease Control, Public Education, and FBI uniform crime reports were all part of this document as well. Next slide. So when we got, this is what our results look like. I know it's hard to read on the screen. That's why you can always find these in the bigger document if you want to look at it bigger. So what it did was rank the overall strengths and assets and took the key. So we had two, again, we had one from the community and one from key informants, which did not always, were not always in sync. One issue, the top issue for key informants was transportation. And that actually ended up really low on our community survey, which actually led to quite a few questions when we started presenting to some of our government officials about why that was. But so it really showed like how certain demographics, the key informants who are dealing with clients who may have a higher need for transportation versus community members who might not. So next slide. So moving forward, how can others in the community use this? So we, at the end of all these different data sections, so the report, if you look at it, has each of those sections like transportation, and it has data from the different sources. It has community, a section on what the survey answers came out. So it has some of the graphs. It has also like pages of all the comments. So we had open-ended questions on each of the surveys about what they thought about each of these topics, and people would write like sentences. They would give, it was actually really surprising. We haven't done this format before. It was really surprising how much people wanted to give input into it. So there were people who, one of the ones that stuck out to me is someone was like, we need more groups where people can just meet together, like women's groups or these different community spaces where people can just get together and meet and talk and build connections. And so all of these sections have like a page or two in most of them that are just comments from community members on what they would like to see in the community and what their concerns are. And so that's some of the most interesting, especially for me, because I am not a data person. I mean, I love to see the data and it's useful and I understand it all, but it's the stories that really, I think, make a difference sometimes. So all of that information in each of those sections was taken and then kind of put into this conclusions, which is priorities and themes. And so we have presented this information to the county, to our city, to multiple organizations. This is on the website where anyone can access it. And so this section kind of ties it all together, but it has all throughout this as ways people can look at either the data or the community suggestions and try to implement some of these things to make a difference around these topics. Next slide. So Health Council priorities. How can the health councils use this document to help identify and move forward with priorities? So again, this goes back to like the input and the comments. So this is an example of one of the pages, and all of the blue is people who commented about ways that healthcare could be better or issues with healthcare in our community. And so what we have kind of done is begin to look at some of these areas and see what could we do either on small projects or what could we bring people together to do. We have heard for a long time access to healthcare is a huge one. And in our community, one of the topics, not just, I mean, access to medical care, but also just access to the resources themselves. We have a lot of great resources, but people don't even know about them. So we started 2 years ago doing a health expo that brings all types of different, not just nonprofits or medical, but vendors who do healthy stuff in the community. We just had it a couple weeks ago, and we had 84 vendor booth type areas. And then we also had 849 door count for people, community members who showed up and we got participant feedback, and people just loved being able to find some of this stuff all in one place. So that's just some of the ways like we can take this information, either the data to help use for funding sources or writing grants, and then use some of this comments as like, some of these are really easy ideas that could be done with very little money and just bringing people together to make a difference. So it's kind of going through that and seeing where the Health Council and where other groups can really make a difference on some of these topics. Next slide. So SanJuanCountyData.org is a site we created through actually another grant that the partnership has several years ago. And this is where we keep up-to-date information in between the needs assessments. So somebody can go to this site and it's really easy. It's really, it's navigatable and has lots of graphs, so you don't have to wade through data and figure it out. You can just go to a topic area and it'll share the data for the county. And it's updated really consistently when new data comes out. So we know the needs assessment is, some of that data is going to be out of date in a year, but we know this is going to be updated. So it kind of pairs together good. And that's really all I have on our needs assessment, but I'd be happy to answer any questions.
Thank you, Amanda. I'm happy to say I took one of the needs assessments because I live here in San Juan. But thank you for sharing out the information. Just going to pause. A heart from Enrique. Any questions or comments from any of the health councils here today? Hearts. Okay. I will say one thing that I love that you pointed out is how much your needs assessment costs. I think it's very critical information to share with legislators as well as our partners and friends at DOH as we kind of think about scope of work, things that go into, planning and assessment. And so I know that Tribal Health Council is actually about $35,000 for a needs assessment. So very similar. So yeah, I love that you pointed that out. Great information. Any questions? Okay. Oh, how long is the process for the needs assessment? From Gina.
Yeah, so it's, we usually anticipate about a year. We start planning a little before that. So, I mean, honestly, it's about a year and a half from first talks with like funders to getting the final document, and about a year from the beginning of the surveys to the last being able to present it to people.
All right. Thank you for the question, Gina. Okay. Well, I don't see any questions or comments in chat, Amanda, but thank you so much for sharing. Very much in alignment with our peer learning series topics so far. So, yes, thank you for the information. Very valuable, and love how you shared out moving forward, how you're planning to move forward with the priorities and the findings. So, okay, before I switch to Shay and have him present, if you all don't mind, we may run over just a little bit, which is totally fine. There is very, very exciting news from Val about House Bill 2 that she's going to share out at the end of this. So if you all can stay on, it's super exciting. You all will be thrilled. So we are super happy here at the Alliance. So if you all can just stay on after. So I'm going to go ahead and share screen again and hand it off to our wonderful Shay. So.
Thank
Shay,
you.
no problem. Let me just pull back up the screen here. If I can do that. Okay, here we go. All right, Shay. So Shay from Catron County Health Council.
Well, good afternoon, everybody. We've actually had a pretty exciting program that we rolled out this last year. And it's a medical alert program that we provide for the residents of our county. You can go ahead and to the next slide. It was a 1-year pilot program. We paid for 100 individual alerts, completely no charge to the person who needed it, but we covered it all. Our total population is 3,579 people in the largest land area county in New Mexico. So it's roughly 2 square miles per person here. So we're awfully spread out. And 43.3% of our population is over the age of 64, as well as 25.9% of the population under 65 has a disability. It makes things very tough. Most of our seniors and disabled people do live alone or with their spouse, but still not having much help around. We have, of course, no hospitals at all in the county. Most people here either go to Silver City for a hospital or go over to Springerville or Show Low, Arizona, which makes us getting data a little hard sometimes. And we did actually at one point up until about 2 months ago, we only had 2 clinics, one in Reserve and one in Camado. However, thankfully, we did just get a new clinic that opened. It's called the Catron County Cowboy Clinic. And they are rolling out and doing great things and actually going into people's homes, which has been a huge benefit to our county. Go ahead and on the next. So with these medical alerts, we did run into some walls that we didn't quite expect. So many of these run off cell service, and really we don't have much cell phone coverage. If you don't have Verizon, then you have no coverage in the county whatsoever. You can't use AT&T, you can't use T-Mobile, you can't anything else but Verizon. Also with the company we were with at the time, for last year, it was really hard to track how often they had been used, and even if they had activated the devices. A lot of the seniors couldn't get the devices activated, and so they just threw them in a drawer, and we were still paying for it, even though they weren't being used. And a lot of them weren't able to be used just because of the location, not having service or a landline, Wi-Fi, just many struggles that we've had that, go ahead and go on to the next slide. So what we've done, we did do a provider change for this year. They do run off Verizon towers, so we have better reception in our more rural areas of the county. Also, we have access now to the portal to deal with the units and see if they're being used, if they're activated. Also, we're able to now have devices on hand. So if someone comes in and they, let's say, want a device necklace, we can hand that directly to them, activate it for them. And if they already have a device, we're able to go into their homes and activate it and train them on how to use. Also, a lot of our residents here are summer only because, of course, it's kind of cold in the winter. We're able to disconnect and reconnect devices. So if they go home for the winter, we're able to disconnect them and they can let us know when they get back into town, and we can go ahead and turn it on for them and have it while they're here. And we have voted and currently extended our entire program through 2025. And I'm hoping with the new provider, we'll be able to go even further and extend beyond that. Next slide. And our outcomes, we've got more residents who are safe to stay in their home, which of course helps their mental health because they're not forced to go live with their children or something. They're safe to be in their home. And they're also able to be independent. They're able to go out and work in their yard and not worry if they fall that no one's going to know and they're just going to lay there. Also, the nice thing, and I'm sure DOH will like this when we have to start reporting on it, we're able to access the usage statistics. And that gives us, of course, more data is always better. And we have a lot of limited data here just because of our health struggles and lack of medical care around here. It'll also be a better and more streamlined program. So we will be able to make sure that we're not wasting money on devices that aren't in use, as well as get devices out to more residents in the county. I believe at this moment, we're right around 74 devices that are active and in use in the county. But I'd like us to see to go all the way to the 100 number and possibly even beyond, because we have the need. It's just getting the word out. We've been using our social media quite a bit to get the word out about it. And any event that we get a chance to do, I'll actually be discussing and letting people know about this program at an event on April 11th that we're doing in the community here, partnering with Amplified Therapy, as well as the county itself. Medical Guardian, I actually caught the question in chat. Medical Guardian is the company that we're using as a provider, and they've been fantastic so far. We're actually, by the end of the month, supposed to be having us all go through our trainings so that we are able to do this all on our own and actually have some autonomy, which makes it much easier and much more likely for the residents in our county to go ahead and use it, because they're kind of anti-government and private people. And if they can just talk to us one-on-one, they're more likely to go ahead and use the service. You can go on to the next slide. I think that's, yeah. And so, yeah, we're looking forward to continue to serve our county. I would love to see this program become indefinite. Of course, through funding through the state, we would actually be able to keep it going, because it's not the most inexpensive program in the world. But we're just glad to be able to have it and use it for all of our residents in the county and increase their health and access to help when they need it. One other little thing just before I wrap up, this also kind of links with our county has a deal with PHI, which is the helicopter insurance. So actually no one in our county has to pay for a helicopter ride if they have a medical emergency. Our county actually goes ahead and pays for that. So we're getting there. Our access to care, that is our chip. We're I think making leaps and bounds of improvements. But I think that's about it. Are there any other questions?
Thank you, Shay. I believe you answered the one in chat, but I have two questions. The first one, how is the need, right? I mean, there's obviously always the need to support our elder communities. Was there anything that struck out to your council that there was like, we have to do this, we have to get the medical alerts? Like, how did that come about?
We were actually meeting with our volunteer EMS staff, and they were running into people who were falling, and most of these elderly people, they don't carry around a cell phone, so to speak, or they only have a landline. Well, they were laying there until someone from the senior center, most of the time, would show up to bring them their meal and realize that they had been on the floor for a couple days. And when we started hearing about all that, we decided we had to do something about it, and the medical alert, we believe, was the answer.
Thank you for answering. I seen Vel's expression. That's just not okay. And so, yeah, thank God for the Health Council and responding. I mean, with the alerts. And my second question really quickly, was that funded through DOH funds, or how did you find funding to purchase the medical alerts?
This year it is going through our DOH funding. Last year we had a bit of a surplus that we were able to use from a grant that didn't have specific deliverables attached to it. So we were lucky with that last year to use that. This year we were able to use the DOH funding.
Yay. So thank you. Again, another way that DOH funding has been leveraged, right? So any other questions? I mean, okay, question from Carrie. How much per person?
Oh gosh, and Joanne, you might actually have a better answer than that on what we're paying.
I don't have an exact dollar figure, but I know it's cheaper than the company that we were with last year. And it seems to me like it was a significant savings, but again, I don't have the figure off the top of my head. We haven't had our final training yet. And we'll have all that information with the final training.
And I can update everybody at one of the next Health Council talks and answer that question more exact after we're done with our training.
Perfect. Thank you. Great question, Carrie. Any other questions or comments? Great job filling a local need. I completely agree, Brenda. This is such a great example. And also an underserved population a lot of the times. Our elder population, and I know our veterans population is another that health councils have been addressing. So yeah, thank you, Shay. Thank you, Joanne. I love the medical alert. Once we saw it in the quarterly report, in the DOH reports, we're like, we have to get this out there. So such a great example.
Thank you.
Yes, thank you all. So thank you to our three presenters, Shay, Carrie, and Amanda. You all did amazing. And I loved our speed sharing we did today. So before we all hop off, I'm going to hand off to Val. She has some super exciting news.
Hi, team. Hi, Health Council. So great to see you all and learn from Shay and Amanda, what you're all doing, the great work, the meaningful work that you're leading in our local communities. Thank you, thank you, thank you. We always reference you all as the unsung heroes of public health in New Mexico when we're engaging with our elected officials particularly. And so baby steps here with the legislative process. We're 24 hours to session being completed. They're done tomorrow. They're still in debates with certain bills. As of today, we do see the essentially $3.6 million that we were able to enlist from last year, enlist legislative support and working with DOH. So that 3.6 remains in the state budget for FY 2026. And as you all know, because you've participated in the advocacy efforts, of course, and has seen all of our calls to action, we continue to work on enlisting support from Senate Finance. And that has proven very fruitful, thanks to Senator Shendo, thanks to Senator Munoz, and members of Senate Finance. They have allocated $1 million towards health councils with a particular focus on behavioral health efforts, which a lot of you, if not all of you, are driving in a variety of ways in various degrees, shapes, and forms. So that's incremental, increase, and it's a testament to the unified voice, the very strong unified voice that we have exercised this year. No, it's in addition to, my friends. So it would be 4.6 million. We were originally, of course, the funding bill from Representative Thompson was a $43 million ask so that new tribal communities could establish their own tribal health council. That bill was tabled, unfortunately, but we continue to work on educating our elected officials and gaining, more traction around building that enlistment in support of all of you. And of course, it goes without saying, it's a collective effort, right? All of us together across the state, county tribal health councils, our community members, our advocacy partners, volunteers, health council members, the board, our small but mighty team of Geraldine, Sam, and myself, and that very powerful call to action that we were all participating in year round with our elected officials. So once again, it's one, step at a time. The session will conclude tomorrow. We continue to keep eyes on HB2. It will go to the governor a week from next week. I think April 10th or 11th is when she's to review and sign off on the state budget. And then that will make it official. And of course, we're already, connecting with DOH to kind of, see what the next steps are, because they are the state agency that procures these state funds to health councils. And so one of the things that we've been advocating is to make sure we have health councils at the table as the scope of work for next year is being curated, so that you can all also inform that process and weigh in what is feasible with this funding. And we're already working with enlisting Representative Small. He's going to be the chair of Legislative Finance Committee, this interim session, which will start in May or June. And so we're already in conversations, asking to please include recurring optimal funding for county and tribal health councils as an LFC priority. And of course, we'll continue to work with our partners at DOH to see what can be included in the DOH agency budget. So we continue to work, all hands on deck, in advocating for funding for health councils. So that it's a timely update that just we're so eager to share with you, and hope it gives us, more energy and excitement and hope for the future. As one of our board members says, there's only one way, and that is up. And as we always say, we're stronger together, my friends. So the Alliance is so happy for this progress and being in service of all of you and in our communities as well. So thank you. Is there any questions or comments or reflections?
Just in chat, thank you for all you guys do. You're awesome, from Joanne. Thank you, Joanne. Okay. Yeah, well, if there's no questions or comments, I hope you're all thrilled with the news. We were literally, dancing on screen the other day when we heard about HB2 and Senate Finance. So, but Val will share a final announcement on Monday, and hopefully, hearts in the chat. So, great. Well, I hope you're all thrilled, and I hope this means you all end on a good note for the weekend. So we're going to end today's session, Health Council Talks. Thank you so much for our Health Council presenters and joining us today. So we'll have the recording and slides out to you all. So have a wonderful weekend. Bye-bye.
Thank you.